Flat feet once kept people out of the military. Now a new treatment is helping those suffering from the condition, and they're getting much needed relief.
And knee pain, shin splints, and even bigger problems, what doctors are now doing to help to heal the issues caused by flat feet.
Flat feet, or fallen arches, is an extremely common condition. As many as 1 in 4 Americans has it.
For most people, it's a painless problem, but for some people with flat feet, they suffer pain from their feet to their backs. Dr. Max Gomez here to tell us about a new procedure to treat flat feet with those folks who are suffering. Talking surgery here, Doc? Good morning.
Well, it is, but it's minimally invasive surgery. I'll explain it to you. Good morning, Maurice. Good morning, Mary. You know, this can be a big help for painful flat feet. Now, while most folks don't think of flat feet as a serious problem, it can lead to knee pain, shin splints, Achilles tendonitis, even plantar fasciitis, among other things. In fact, flat feet used to be enough to get you out of the Army. Here's a solution.
So you have good mobility still left in the heel.
Normally, you wouldn't think a 13-year-old would have much of a problem with her feet. Certainly not something that might call for surgery. But Catherine Roofley had a problem that was giving her a lot of trouble.
I didn't have an arch in my foot, and sometimes it would hurt my foot if I was like running, and I had trouble running, and I was like pigeon-toed, my feet would go inwards, and it was annoying, and it didn't look good or anything.
This is an x-ray of one of Catherine's feet, not much of an arch, but an even bigger problem was how that led to an inward turning of her ankles, as in this photo, what's called overpronation.
You end up getting arthritis, not just of the foot and all of the joints of the foot, but arthritis of the ankle, the knee, the hips, the back. People end up with tremendous pain and disability. They have a lot of difficulty walking.
Now, that doesn't happen to everyone with flat feet, and orthotics or arch supports can ease the problem for many folks. But when you have this sort of serious overpronation and painful flat feet, chances are you're going to develop long-term problems. Now, there's a minimally invasive surgical procedure that can help.
There's a natural hole between that ankle bone and the heel bone that if you can restore that space, you can stop that ankle bone from falling down and bringing it with it all those bones and prevent that hypermobility.
Here's where the insert would go in the bones of the ankle, inserted through a tiny incision on the side of the foot. This is Catherine's foot after the surgery, a restored arch with the metal insert visible. Catherine had it done on both feet.
They don't hurt anymore, and I can play more sports now, and I don't trip over my feet anymore.
Now, Dr. Ramcharitar-Amante says that the ideal candidate for this procedure is actually a young person who has a severe flat foot but still has a flexible foot, because the longer a person goes on one of those overpronated feet, the more likely they are to develop arthritis that can eventually fuse or severely limit the ankle's mobility. Now, here's what that little insert looks like. It's kind of like a little, you can't really see very much, it's a little green metal screw almost, and it can be easily removed for any reason if there's a complication there. You can have one for your own feet. How's that?
Wonderful. Now, the patient you spoke to, it was only 13, so you wonder who gets flat feet.
Yeah, it's interesting, actually, believe it or not, most flat feet are inherited. If one or more of your, one or the other or both of your parents had flat feet, chances are pretty good you're going to have flat feet as well. But it can also be, you can also develop it later on in life as a result of diabetes, stroke. It can actually be due to trauma. If the tendon ruptures, the one that on the inside of the ankle that kind of holds everything up, it ruptures, that allows the pronation and the arch to kind of fall down. Wow. So it can be from a variety of different causes.
It's all connected.
By the way, it doesn't get you out of the Army anymore.
No.
And now with this, everyone's okay.
Well, we'll see.